Good morning. It's just after 5 a.m. here in Calgary, and we are going to do a little bit of hip stability mobility along with some spine stuff. Now, of course, as we do these things, our shoulders will also be impacted, but our focus will be on connecting our pelvis and our spine with a theme of mobility and stability. So we need to have a block, and if you've got a spinal strip or a rolled mat will do just fine too, okay? So let's begin on our back, and there are 3 levels to this block. There's low, medium, and high. It's 5 a.m. here for me. I'm going to start low. You, of course, can decide for yourself where you want to be, but I'm just going to start low here and just resting on back and letting yourself settle in and breathe. And this might feel just completely yummy. And you could always go up to middle. Let's not go to high though yet. But to know that if you're at middle and it's too high, you probably will feel some strain. Even if it's normal, any strain or ache. And so if that's the case, then come back to here. We're not trying to get a stretch here. We're just trying to start a practice, settle in, connect, and breathe. And then I'd like you to, I'm going to scooch back with my screen a bit here. I'm going to scooch back, you just take one leg straight now. So if I show you from this angle, it's one leg straight. And then bring that leg back up again. And one thing you want to notice is that as you're taking this leg straight, you're not rocking your whole pelvis to one side. And so move yourself only as far as your pelvis stays steady and does not rock left to right when you straighten that leg. And bring that leg back up. Okay, so now we're going to straighten the leg this time again, but this time we're going to keep the foot on the ground the entire time. So the first one, I just let the foot come up. Now we're going to keep the bottom of the foot on the ground. You're not going to go as far as you take the movement. Yeah. It's not about going far, it's about doing the movement. Easy breathing. And then bring the leg back up. And then same with the other leg. And then bring the leg back up. Okay, let's take the ankle up, rotate the leg bone, and place it on the opposite knee. So we're still up. If you're finding that this is not comfortable through your pelvis and your spine or anywhere else in your body, you can take the block out. We're just going to play around with moving that leg bone in the hip socket. And again, as we've done with others, is make sure it's your butt that's doing the rotation for you, not the front of your hip. When you push your leg away, great. Okay, and let's go back to the other side. lovely. And then bring that down. Okay, now block comes out. Drop your pelvis down and just stretch your legs out and just notice what you feel through your body. See what's just happened. All right, lovely. Okay, so now what we're going to do is we're going to stay on our back. I'm just going to shift my orientation for you a little bit. We're going to come and bring the leg up like this. We're going to move one leg over, so I'm bringing it towards the camera. And then this leg is going to follow. Then we're going to bring this leg up. Legs are wide and over. So here, the shoulders, we want to keep the shoulders on the ground. That's the first part. The second part is this, the leg that's leading is leading, and you let that leg move as far as you can, and then the other one comes, and then over you go. So you don't want this to happen. Yeah? So only go as far as that shoulder is on the ground. Now you can play around here with pelvis to spine to ribcage connection, and you can just say, hello pelvis, you can just move around a bit. But don't pull it. I wouldn't pull it. Just bring awareness to it. Easy breathing. Okay, so now we're going to move into a hover. Now, typically when we do hovers, or not when we, I mean, there's lots of ways of doing these, is that people tend to do it from a position where they're on their side and they lift a leg, but I'm not going to do it that way. It's going to look a little like this, but it's not going to be this, okay? Instead, we're going to do the twist that we just did, and we're going to end it over here, shoulder girdle's on the ground, and leg is going to hover. Now, ideally, okay, I'm going to just come up for a second. Ideally, we'd like to have this leg level. So if we were to put a level, like a construction level, a Renault level, on your leg, it would be level, ideally. Some of you might not be able to do that. That's okay. So if you're here, that's where you are. Okay, that's all good. That's where we're moving toward. Don't try to make it happen, because it's not about the movement, it's where you're moving toward, and just notice where you're at, okay? So you're here, one leg comes over, shoulder girdle stays where it is, and let's come over, yeah? So you've got a twist in your body, twist in your spine, and you're now holding this leg. So you're going to be utilizing this outer hip. Do your best, I'm going to angle off here for you. Do your best not to really grip it through the front of the hip, like the hip flexor. Let the outer hip do the work. And the shoulders are on the ground, yeah? And now I just noticed in the camera my foot was dangling down. I'm going to bring that foot back up. I'm not going to make it a Tadasana foot. I don't want the foot to take over the outer hip, but I do want the foot to stay in a bit of a line with the leg. We're just going to be here for a few more breaths. And you might feel this outer hip saying, hey, you want me to do what? So if you like this position, I mean, sometimes when I practice this, I might practice it for 3-5 minutes even. It becomes interesting as you build up those minutes. Okay, and then come on up, and we're going to go the other way. And come into your twist. So the shoulder girdle is even on the ground. This leg is level. And we get to, or we're moving towards level. You get to feel this in the outer hip. And your outer hip is saying, Yahoo! This is awesome. And then coming on back, good, and resting your feet down and straightening those legs out, and now just notice what just happened. What just happened in this body having done that? Maybe feel something in your hips, maybe feel some freedom around your pelvis or your torso, possibly. Okay, let's bring one leg up. So you're at 90 degrees, hand onto the knee, and you're going to press this knee into your hand. Watch that you don't over brace with your ribs. And then other side. Okay. Now, if you have a spinal strip, then you can take this spinal strip and you can fold it in half. If you don't have one, you can use a rolled blanket or a rolled mat. The same idea. Okay, and it's going to go right at for women, right where the bra strap is. So right about opposite the bottom of the breastbone, which is about T7 of your spine, T8. And lie on back here. Just rest back. This is an extension of your spine, right at about this area. You can see how my pelvis is lower than my heart and my head. If you want, you can bring your hands up to the sky now and have your thumb tips touch like this. And then raise your arms to the sky. So the movement of your shoulder blades is protraction. The arms move away from the floor and they come back. Up and then back. Up and back. Up and back. And then arms come over the head and then back. Now remember, when you do this, just because you can go alongside your ears doesn't mean you should, right? So if you find yourself, your arms are wobbling, or there's a click or a clunk, or there's pain or ache, then your range might be just here. So then that's your range. Okay, or it might be further. Lovely. Okay, and then bring that down and take the strip away from your body and just rest back on your back and notice what that feels like. And let's slide one leg straight, one leg up to your body, and then take a twist. And come back and take a twist. Now lie on your back. Again, notice what you feel having just done that. And you can stay on your back for as long as you would like, or you can come up into a sitting position and notice what it is that you feel as you sit. And maybe if sitting in this position doesn't quite work, you can come into a kneeling position. The key is you just want to make sure that you're not having to lift really, really hard and that your pelvis is in a comfortable position for your spine to lift. But the bottom line is just to feel what it is that you feel having done those few movements, and what do you experience inside. And now from here, you might want to do something more vigorous. You might want to do something more gentle. You might want to go the Yoga Nidra way. You might want to go a run workout, more vinyasa way. Or you might want to join me for a tea. Either way, or whichever way you decide to go, you have a really, really great day, and we will see you tomorrow. Have a great, great day. Thank you for joining me. Take care.